and Watchman, TAVR, MitraClip. No, they aren't part of the next superhero movie. Today, doctors from Penn State Health Milton S. Hershey Medical Center will explain what they are and how they're helping heart patients in the mid-state. And you'll meet one patient who struggled every day.
I couldn't walk more than 5 or 10 steps without gasping for air, without being totally out of breath.
That's until heart doctors at Penn State Health came to the rescue. Eating healthy is important for good health. A dietitian from Penn State Health will share some healthy eating tips. And happening right now, a specialist from Penn State Health is here in our studio taking your questions during a live web chat. To ask your questions, visit abc27.com/heartchat. Good afternoon. Thanks for being with us. Today we're bringing you a special edition of Good Day PA sponsored by Penn State Health. I'm Amy Kem. Well, February is still a few days away, but we're getting in an early start to celebrate American Heart Month. Today, we are talking about structural heart disease. What are the risks and how are these diseases treated? Let's look at some facts. In the United States, there are about 100,000 aortic valve replacements every year. There are around 6 million people who have atrial fibrillation, which is a common cause of stroke. So let's walk through this. With me now is Dr. Mark Kozak, an interventional cardiologist at the Penn State Heart and Vascular Institute. So let's start with just an overview. Structural heart disease, what is that, sir?
Well, structural heart disease is a collection of problems that are by no means new. These problems have been around for many years. And what's really changed is that we now have new treatments for these problems. And these treatments don't involve open heart surgery or big operations. So because many of these conditions can now be treated with catheter-based techniques, the name structural heart disease came to encompass these problems.
Let's talk then about some of those treatments that, as we were talking about before the show, it does not require a huge incision in your chest or lots of scarring, which can be scary. So what are some of the options?
Well, that's great. I think the problems that we treated or were most interested in are those that are fairly common. So, for instance, aortic stenosis, as your opening remarks noted, is very common among older folks. And so that's one of our big things in structural heart disease is catheter-based aortic valve replacement, which is also called TAVR, T-A-V-R. Repair of abnormal mitral valves with the MitraClip is another relatively common procedure that we do in structural heart disease. And implantation of a device called the Watchman for patients who have atrial fibrillation. So those are the things that are relatively common. We have a large number of less common procedures that we do for less common problems.
What is it that you have here today?
Well, great. When people hear a catheter, I'm not sure that everybody understands what this means. This is a catheter, and what it is it's a hollow tube that's a little bit like a straw, and one end's inside the body and one end is outside the body, sort of like an IV line. And then through the center of this straw-like structure, we can pass equipment. So I think it's remarkable the amount of engineering that has developed. So you would think that with a catheter like this, what can you put through it? But I'm going to show you an example here of one of our medical devices that will fit through a catheter about this size. So the catheter that I have here is roughly 3 millimeters, and the ones that we use are in the range of 3 to 8 millimeters in diameter. And here is through a 3 millimeter catheter, you can advance a device like this that looks quite a bit larger when it's deployed.
Sure.
So that's the magic of modern engineering.
And then, so the incision in the chest is so tiny, really.
Well, typically the incision or the entry is in the leg, and it's about 3 millimeters for this. So you'd have 3 millimeters, you'd barely be able to see it.
Talk to me just very briefly about the specialists, the staff they're part of this program at Penn State Health.
Well, there's a veritable army of people involved in this. So in our program, we have interventional cardiologists. We have other cardiologists who do imaging and heart rhythm management who work with us. We have radiologists, heart surgeons, anesthesiologists. We have a large number of X-ray staff. We have echocardiographers. So it's a really big group of people that makes this work.
Yeah, and make it work. It is. You're saving so many lives. Thank you so much for being part of the program today. Good to talk with you right ahead of American Heart Month. Now, as part of this special on Good Day PA, ABC 27 and the Penn State Heart and Vascular Institute are hosting a web chat. Deborah Pinkerton is here now with viewer questions. Deborah.
Hi, Amy. Thank you. Joining us right now is cardiologist Dr. Michael Farbaniec. He is, as you can see, busy answering your email questions right now. In fact, you can log on to abc27.com/heartchat if you would like to chat with him. Doctor, I know you're busy answering some questions, but we have a couple of viewer questions right now.
Sure.
This is the first one. I'm in my 40s and sometimes receive a stabbing or burning pain in my chest. It only lasts a few seconds. I eat healthy and exercise regularly. An EKG didn't show anything. What can it be?
Okay, well, first off, kudos to eating great and exercising regularly. That's very, very, very important. But always remember, not all chest pain is going to be heart-related pain. Lots of things can cause chest pain, muscle spasms, costochondritis, which is kind of inflammation of the ribs. What you want to worry about when it comes to chest pains related to the heart is going to be pain that happens with exertion when you're moving around. Let's say you go up the stairs and you start feeling a pressure in your chest. Sometimes sharp chest pain may not be heart disease, but again, that pressure sensation while you're exerting yourself is what you can worry about.
Okay, second question. Looking at my family history, there are heart problems on both my paternal and maternal sides of the family. Is there anything I can do to prevent getting heart disease, or is there no way to really avoid it?
Well, again, in this case, nothing's inevitable. You don't want to give in and say, oh, whatever, I can do. I'm not going to do anything to help myself. So if you're a first degree or second degree relative, when you're male less than 55 or female less than 65, does increase your chance of heart disease almost by 2 times. But you can still diet and exercise and see your doctor regularly to try to prevent heart disease from developing, even with a family history.
Okay, doctor, we will check back with you a little bit later. To submit your questions to the doctor, log on right now to abc27.com/heartchat. Back to you, Amy.
Okay, thank you so much, Deborah. We'll check back in just a little bit. But coming up next, Stu Levin couldn't walk more than 5 steps without gasping for air. His story is coming up next on the special Good Day PA on ABC 27.